This is part 3 of the Clinton Conference, and the subject matter of this third part is how psychiatry is not a medical practice. But what you're looking at right now is kind of an overview of the scientific fraud and racketeering complaint that I filed with the U.S. Attorney's Office in the summer of 2003. And I'm going to do that as part 4. I'm going to demonstrate what data was given to the U.S. Attorney's Office in New Haven. His name is Kevin O'Connor. He got his job as a U.S. Attorney because his wife worked in John Rowland's legal office during all the DCF Rowland Gate crimes. So we wonder what it was she did in that legal office. Mrs. Kathleen O'Connor, Mrs. U.S. Attorney Kevin O'Connor, was the one who recommended Mr. O'Connor for the job of U.S. Attorney. And we, other activists, not necessarily Lyme activists, attended the Connecticut Judiciary Committee judge approval hearings, and we found out that some people are approved for judges in this state who have 0 trial experience. Other guys are corrupt, like this guy Scheinblum, who just criticizes all the so-called criminals, and the Connecticut courts believe in processing people as fast as they can, and the way that they phrase that is, let's dispose of so many cases as soon as we can. That's justice. So the fact that Mr. O'Connor is the U.S. Attorney, and the fact that we have all this corruption in the courts, people have 0 experience, can be judges, and you have all these idiots who work for the Department of Children and Families and Department of Mental Health and Addiction Services, none of whom have any science background, all of whom told me I was insane to be saying all these things that you've seen in the previous videotapes, which, as you know, this is data taken out of the National Library of Medicine, and if the Department of Children and Families thinks these scientific journal reports are insanity, then, I don't know why we pay their salaries. So that's the overview of the racketeering complaint. The central racketeering entity is the ALDF.com, I know, for a commercial entity. It is the American Lyme Disease Foundation, and it was founded by apparently Kaiser and SmithKline at New York Medical College. At the time New York Medical College was financially floundering, there was a gentleman there named James Connolly, who was president of the New York Medical College. For this sellout of the medical college, he was allowed to be chairman of the ALDF. He then went on to found CastleColony.com, who published, quote, Top Doctors. It's a publication where supposedly you can buy that book, and Mr. Connolly and Mr. Castle, both of whom their first name is John, will tell you who the best doctors are. But if Managed Care is actually publishing this book, then that's not a recommendation that you want to take, because these are HMO hoes. The entity, the ALDF.com, is a central racketeering entity. People who own the patents for all of the vector-borne diseases, potentially future vaccines and test kits, and big insurance, they're part of this entity, namely SmithKline and Kaiser. And the universities involved are, of course, Yale and New York Medical College. The incident that started all this was the publication of a Reviews of Infectious Diseases supplement. Reviews of Infectious Diseases is the name of the journal published by the Infectious Diseases Society of America. In 1989, they published a supplement specifically on spirochetes and Lyme disease, and they found at that time, and most of these are scanned into my website, these very significant journal articles, that they didn't know what the treatment endpoint was for chronic neurologic Lyme. So then they arbitrarily said it's a month. The treatment of Lyme disease discussed by Raymond Datweiler and Ben Luft was one of the articles, and they cite studies by Leonard Siegel, S-I-G-A-L, and Alan Steer, in which they said treatment failed in about half the cases. So in 1989, it was known that treatment failed in about half the cases. That's not what you hear now. Now you hear that Lyme disease is easily diagnosed and cured. People who have chronic neurologic Lyme, as you've heard, are told they're just crazy and don't have a real disease. Subsequent to that, in 1984, was this Dearborn farce of a conference. CD staff themselves have patents. If you go to my website, in the top right-hand side, in the right-hand navigation bar, click on that green link, and you'll see 5 patents owned by CDC staff members. They're patents in Europe with the CDC staff members' names on them, and they're patented with SmithKline. So CDC staff members stand to profit personally if SmithKline and other companies decide to manufacture any of the recombinant proteins that they have patented. So keeping Lyme spun is in the interest of CDC staff members. Now, Americans might not be too happy with that, because if they're sick and they're getting this bullshit from the ALDF and Big Pharma and Big Insurance, they might not be too happy to discover that CDC officers are participating in screwing people over, denying them care, adding to their disability, denial of benefits, losing their homes, and everything else. But this is what we pay for. The 2 vaccines were Immulyme and Lymerix. So this topic is the continuation of this conference, and it is, I'm going to tie up a few loose ends from the other talks, and then I'm going to go into how psychiatry is not a medical practice. It's not a scientific practice. The psychiatric terminology doesn't meet the rules of scientific validity. They're just kind of subjective terms. Note that when I say psychiatric terminology is subjective terminology, simultaneously the bad guys here say that we have subjective symptoms, and that is because they refuse to do the valid testing and look for the valid markers of disease that we talked about in video 2. I better just back this up. So, insurance companies definitely know about the bullshit in psychiatry, because they use it to their advantage. If you are sick with chronic Lyme or chronic fatigue syndrome, they'll send you to a psychiatrist, and the psychiatrist will not run any valid testing on you, and they'll say, oh yeah, you have depression, or you're just reactogenic, or you have some other psychiatric mumbo jumbo term. The insurance companies say, well, psychiatric disease is not a real disease, so you're not sick, we're not paying for it. So, in this way, these scumbags, Kaiser, Blue Cross, Oxford, PHS, and all the major insurance companies are all too happy for you, as a person who has chronic Lyme, to get a psychiatric diagnosis, because then they can cut you off after 2 years, because they'll say that your primary diagnosis is psychiatric. It's all subjective, and psychiatry is just a diabolical entity. They evaluate you. They have their own sets of values. If you don't agree with them, for example, if I don't agree that every matter is not a penis or a sex matter, I'll be diagnosed as insane, because I don't agree with that guy. Yet, that could be forensic evidence. In other words, the only kind of evidence in a court that isn't actually evidence is the opinion of these airheads who don't really have any medical expertise or scientific. And they, a lot of the time, don't even realize it. That's how stupid they are. Think about it. You go to medical school, and you have a choice between becoming a neurologist or a neurosurgeon or a psychiatrist. The person who has the most talent is probably going to be a surgeon or a neurosurgeon. You never find a psychiatrist there participating in the separation of Siamese twins joined at the head. That's the most level of expertise we think we know exists in the medical field. But a psychiatrist is never there. He doesn't have anything to do with that actual medical stuff that actually helps people. They just sit there and project their own opinions and their own observations about your behavior based on their own behavior, which couldn't be more ridiculous. I don't advise anyone ever seeing a psychiatrist. They're all sick-minded bastards. And they can ruin your life. Now, I went looking for a picture of Mr. Brain for this talk, so I can do a little, morphology for the audience. And so I just went to Google and I said, the brain. I said, surely I'll find a picture of a brain so that I can copy it and put it on this board. And the first thing that comes up is something by Harvard. That's where Alan Steer is, by the way. And no, I don't know that because I stalked him. Normal brain, the whole brain atlas. This is Harvard. I have this printed out in longitudinally or whatever. And inflammatory or infectious diseases, you can see that Harvard thinks this is where Lyme belongs. So, it doesn't belong in the psychiatric department, it doesn't belong in the penis envy department, and it doesn't belong in psychosomatic disorders department, and it doesn't belong in the knee diseases department. It's here with Mr. Brain. I'd like you to note that in that textbook, the famous BS textbook of all time by the American College of Physicians, which, you ought to be scared because if the American College of Physicians could put their name on this book, then you really are on your own in terms of medicine in this country. In this book, on page 148, there's a chapter by Lenny Siegel, same guy who found that antibodies to heat shock proteins could cause illness signs, says in the bottom left-hand corner what this disease is that we really have. It's called Lyme borreliosis. On the opposite page, he says, with widespread calling under the chapter heading Lyme anxiety. The bad guys, Yale University says, we don't have Lyme, we just have Lyme anxiety. It's the fear of getting the disease that makes us so nervous that we get ourselves sick. If you can believe that bullshit, that's what they publish. That's what they say to the media. Now, anybody who has Lyme disease will tell you, no one gives a shit if you say you're sick. Not even your own family. Nobody knows how sick you are. They don't care. If you say every single day of my life, I feel like I have the flu and my head's killing me. They're like, you're making that up, that's not true. And then when they get sick, it's very serious. So in this Lyme anxiety section, Lenny Siegel says, with widespread anxiety about Lyme disease has come Munchausen syndrome and Munchausen's syndrome by proxy in those concerned about chronic Lyme. So, he's making the assertion that we're poisoning ourselves and our children for the attention that it will give us, and that this is an epidemic. If you can believe that insanity was published by the American College of Physicians, or that is, if you can't believe it, buy this book. So you see how they use these psychiatric idiots as tools, weapons against people who really are sick. Looking around for some structures, I'd like you to note that, and I'm going to zoom on this. Oh no, I already am zoomed. The top picture is a tricyclic molecule. This is a benzene ring. This is a benzene ring. Benzene. They're flat. They're planar. Planar and highly electronegative across the top, across either side. This is a lot of electron sharing here. It's these little corners. Every single one of these corners, except where it says S and N, is a carbon atom. Carbon likes to have 4 bonds. when they have 3 or 2. They're very electronegative and they're sharing. So this is a flat, planar, phenothiazine molecule. This is basically the phenothiazine shape. Without the functional groups, this is the phenothiazine. Phenothiazines were used initially as pesticides. They were also, this is Thorazine, the first so-called antipsychotic. It's actually a brain anesthetic. The one below it is methylene blue, which is a microbial stain. So the same class of molecules, they now say, are pharmacotherapeutic. Given to people, this drug turned people into zombies, and psychiatry said, oh, that's a good thing. It must be a drug. When in fact, chronic exposure to this kind of drug, dopamine antagonists, results in a year's time, nearly an 8% loss of brain volume. That means it kills so many brain cells, it's notable within a year. Psychiatry doesn't want you to know that. On my website, associated with this videotape, is a list of references. I gave them in full text to a Laura Lustig, Lustig, on November 20th, 2003. And I gave her an interview sheet. Lustig didn't know the first thing about autism or Asperger's disorder, although she claims to be an expert in cognitive disability, so that's kind of a shock. Tried to say I was paranoid to be saying there was a controversy over Lyme disease, which means she's either off the charts stupid or a liar. And 6 days later, my kids were kidnapped. And they tried to commit me right then and there by Patricia Levens at Yale University. They were very nervous about these reports. They're on my website associated with this video. Links. I gave them in full text to Lustig. They flipped out because all DCF does is kidnap and kid drug. And they didn't like the fact that I proved that they're all brain damaging and actually kill brain cells. And that this is well known that you give a person a central nervous system depressing, I'll say toxin, because that's really what these are. They will, in response, have a chemical equilibrium response. So an alleged dopamine antagonist competes for dopamine in the receptor, neuron receptor, will over time cause an increase in dopamine transporters and receptors to compensate. So when you remove the drug, you have too much dopamine. Then these people are really spazzed out. They also get a condition called akathisia, which is psychomotor agitation. And psychomotor agitation is a result of 3 processes. The destruction of pyramidal cells in the brain, and I'll spell that and show links. Well, there are links to that on the website already. They can be destructive to GABA, or gamma-aminobutyric acid, which is a neurotransmitter. It is the stop to dopamine's go. These things, when they degrade, bind the GABA transporter permanently. So you can't transport GABA. So you're always stuck on as a result of taking these meds. So you're more spazzed out. And then, of course, they cause more agitation. They cause dementia. They make you even more demented and even more agitated, even though they're supposedly central nervous system depressing agents. So that a kid who has been kidnapped by DCF, given these drugs, ends up more demented, more insane, more agitated, more out of control in a short amount of time. This is the science. I'm going to stop the video for 1 second because I need to draw the graphic. These are the only valid, scientifically valid axes. You know, and in the DSM they have 5 different axes. These are the only ones that are actually valid that you can discover, have any basis in a laboratory. Sorry for this. People tell me they can't see it too well. It's part of the trade-off with having a Windows movie file. Traumatic, organic, and genetic. There are no other ways to frame something that is not perfect normal mental health, which we don't even know what that is. Nobody's down here. Nobody falls in the negative area. You can't have lived a life and had no trauma. You can't have lived a life and had no illness signs. You can't have lived, well, we don't know what normal is, because psychiatrists don't even attempt to discover. They don't go about it in the right way. In other words, they'll take a bunch of people and they say, well, you kind of all behave the same. Let's do this brain imaging. And then they'll say, well, we can't make any determination. And that is because they don't start with the brain imaging, then separate people into groups and see if they perform a certain way with tests and things like that. Valid cognitive testing, your computational skills, your short-term memory, your visual spatial abilities. Those are all valid assessments of your mental functioning. Organic Lyme disease belongs in the class with AIDS, as we know from Harvard and all the combined national institutes. They agree. Neuro-AIDS and neuro-Lyme. Lyme is a neuroborreliosis. It's neurosyphilis. It belongs in the class where you have markers of illness going on. You have antibodies circulating in your blood that you shouldn't. You have cytokine dysregulation like interleukins, inflammatory molecules, tumor necrosis factor, things that influence the blood-brain barrier, which is simply the tightness of the vessels in the brain too, and in response to penetration of the brain by these molecules in the blood. Blood-brain barrier is a condition where the vessels in the blood are tight. They don't want junk or infections or even drugs getting in there, which is the reason they do intravenous antibiotics for Lyme. It gets the highest concentration of these antibiotics into the brain by going in directly. Alzheimer's. And all these are changes. Anorganic changes. Psychotropic drugs can cause brain damage. Rather than it being true that a person who has a mental illness has a chemical imbalance, the drugs actually cause the chemical imbalance. Pfizer has published how to treat SSRIs-induced akathisia, while they simultaneously say it doesn't cause this, if you read that report carefully on my website. The Zoloft murderer, Chris Pittman, was a victim of abuse. His parents were abusive. So then he got the psychiatric diagnosis rather than the parents. Then he was treated to Zoloft, which made him nuts, and he killed his grandparents. So Chris Pittman is a triple victim because psychiatry doesn't do anything right. If you're the victim of abuse, you get the diagnosis. If you're a teenager and your parents are nuts, and they send you to a psychiatrist because you're acting nuts because they're being nuts, you get the diagnosis. The insurance company will not pay the psychiatrist for a diagnosis of this child has abusive parents, because the insurance company will say, well, we're not paying for that. And traumatic head injury, being kidnapped by DCF. There's a report on my website by the Vander Kolks. The highest correlation is the development of complex PTSD, which we'll call a hyper-alertness state, because they're chronically scared, so they're in the mood to be chronically scared because they don't know what's going to happen to them. DCF, there's been a 445% increase in children taken from their parents in this state under John Rowan's administration, and a 300% increase in DCF's budget, but nowhere near a similar increase in the population. They just kidnap as many kids as they can. If they don't have a valid case of child abuse or neglect, they will say the parent is crazy for objecting to the false allegations, and they will just arrest you. And then because they falsely arrested you, then you're a bad parent because you were arrested. This happened to my friend Chris Kennedy too. The DCF worker just walked right up to him and said, well, I'm going to have to charge you with something. In other words, they had nothing going on, so they're just going to lie to the police, bag you, take your kids, boom, game over. DCF's so out of control and why they have such a terrible reputation. They're nuts, they lie, they commit crimes themselves, they party and screw with each other all the way up to the top, but if parents do the same thing, they're bad parents. And chronic abuse. It could be even chronic verbal abuse. So psychiatry has it all backwards. Because it started with Sigmund Freud, who is the famous, everything has to do with sex guy. A long time ago, this is a very important book, everyone should read it, I read it, was finding that his so-called hysterical patients were victims of childhood abuse, childhood sexual abuse, and so forth. But the parents, the fathers, didn't like that. They were paying Freud. So he said, oh, okay, yeah, you're right. These women don't have enough sex. That's their problem. I'll diagnose them, because that way I'll get paid. And ever since then, they blame the victim of abuse. They blame the abuse victim. The abuse victim gets the label. They then get the treatment, which is always brain damage. Street drugs have the same drug action, drug activity, mechanism of action as psychotropics. They're all receptor or transporter blockers. The serotonin reuptake inhibitors, or the SSRIs, are transporter blockers. And what this book tells you is that this guy, Freud, was so whacked out that he actually diagnosed one of his victims, who, the whole class now of women who are so-called hysterical. Freud invented that, well, they're not getting enough sex, they're sexually repressed. So blame the victim rather than the abusive parent, the one that abused them when they were younger. He had a patient who, he said she was masturbating too much. Okay, well, whether or not that really happened, or whether or not being abused by Freud made her even more nuts, which is likely, because they won't validate your traumas, because then if they validate your traumas, they'll blame the actual bad person, the person that caused you harm. He did nasal surgery on this woman, because he apparently thought the nose was connected to the genitals, and this is the father of psychiatry. I'm going to get some of the other articles that I gave to Neuroleptic, and I'm going to simply read what's in there, and you'll be shocked. This is a data for 2.5-inch data binder given to a Neuroleptic, Lustig, at the New Learning Center in Westport on November 20th, 2003. And my kids were kidnapped 3 days later. And they defrauded the court with the order of custody, and they didn't mention to the judge this is what they were looking at. In addition to another notebook, which the DCF's Patricia Levens didn't tell the judge what it was. It was a substantiated complaints to the Commission on Human Rights and Statewide Bar Council complaining about DCF's lying to the judges, and Sarah Gibson lying to the Statewide Bar Council and the Commission of Human Rights. Sarah Gibson was fired. So they just flipped out. I mean, they don't want it known that that there's a whole bunch of scientific references out there that prove that all psychotropics are brain damaging, because all the DCF does is kidnap and get drugged. They're very, very pissed that they shouldn't be doing this. Pathophysiologies of psychotropics induce brain damage. The axes, trauma, organic and genetic, cytokines in the brain. In other words, if you're sick, it's going to affect your thinking. That's a no-brainer. If you don't feel good, or if you're tired, you lay down and take a nap. Now, is that an illness behavior that you do to get sympathy, or is it because you just want to sleep? That's what you have to deal with these psychiatric idiots. They turn everything upside down. So what are the valid methods for differential diagnoses of nervous and mental disorders? That's these. You can do these things in the laboratory, find these markers. So then if a person has these things, they don't have bipolar or some personality disorder or something like that. They have this compromise, X, Y, and Z axes compromise, that's scientifically valid. Never mind the bullshit that you get from psych.org. So I gave her this questionnaire. Then they bagged me and my kids, which is like, how dare these idiots? They tell me I'm insane to be They tell me I'm insane to be a human rights activist, and they said I'm a negligent parent for doing all this research because my kids have Lyme. They have congenital Lyme. That's beyond dispute. The blood tests for me and my children were given to Yale's Robert Schoen when I was pregnant with my third kid. And of course he told me, I don't know what you have don't have Lyme, blah, 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 blah. But, I have proven previously that this is a great big scam. They don't want it known that Lyme is a neurologic disease and that it can be congenitally transferred. Before the harassment of yours truly, Ed McSwegan and others harassed Karen Forstner of Lyme Disease Foundation. That's Lyme.org. Karen had a congenitally infected son who was severely disabled. He died at age 6, so they started the Lyme Disease Foundation. So they don't want it known. Yale University doesn't want it known that you can congenitally infect your kids. But this is Connecticut, and, it's like Hollywood, big facade, no real reality going on, no class, no real class. Only rich people live here. We don't like black people. We don't like poor people. So we torture them. And we don't like sick people. We don't like anybody on welfare. Only people who live in Connecticut have to be either rich or cops. So anyway, cardiovascular effects of antipsychotics used in bipolar illness. The full text given to DCF. By the way, Laura Lustig's second in command was a Marcus, M-A-R-K-M-A-R-C-U-S. He was a former DCF commissioner. I didn't know that at the time. Neither did I know that Laura Lustig has a contract to train the DCF lying morons. I give her all this data. They flip out, declare me insane, take my kids, bag me, throw me in jail, call me a terrorist. I had to plead guilty to being a dangerously intelligent Unabomber terrorist in order to be let out of prison. They were so mad about this, because this is all that DCF does. Kidnap and kid drug. And this is brain damaging. This is a very significant one. It's a seminal article published in 1993, and the title of it is Loss of Striatal Cholinergic Neurons as a Basis for Tardive and L-DOPA-Induced Dyskinesias. That means movement disorders, the body rocking and the pacing and being spazzed out, because if you're doing that, you feel that. Neuroleptic-induced supersensitivity psychosis and refractory schizophrenia. In other words, someone gets diagnosed as schizophrenic without any validity. People who are schizophrenic, there's 4 different types of schizophrenia. I'm assuming they mean the brain damage or the encephalitis type, or people who are just demented. Schizophrenia used to be called early dementia. If we did some valid testing on these, drew some spinal fluid, did some brain imaging, you might find they had some kind of an encephalitic event, or they have a brain infection. But no, psychiatry won't do that, because then they'll lose the patient. The patient will then go over to neurology or into the medical field. The reality field. In this article it says, these two syndromes are commonly associated with movement disorders, have similar predisposing factors and pharmacology, and are potentially persistent. We suggest that these conditions are also result from degeneration of cholinergic striatal interneurons following chronic drug use. And they go in to say that they've got plenty of evidence of damage and destruction of the nerves. The big thing. And they talk about every single one of these antipsychotics, even clozapine, which is supposed to be safe. I recommend every parent and every adult in this country go to the medical library and get this report. It's linked from my website. The authors are Miller and Chouinard, C-H-O-U-I-N-A-R-D. Psychiatry doesn't want you to get this. They also don't want you reading about the history of Sigmund Freud. Therefore, get those references. They don't want you to read it. Read it. They don't want you to know that all this bullshit happened in the beginning of psychiatry, and that it's all hypothetical, sex-obsessed nonsense and a whole bunch of theories without any kind of science. If they say don't go here, go here. You're a parent, you got kids, you want to find out what kind of bullshit you're facing. You have an obligation to. It's a very, very long article. Go into great detail of how this damage occurs. This is brain damage from psychotropics. DCF decides your kid needs to be drugged. Leave the state immediately with the kid. Don't use your phone because they bug your phones. Follow you around their cars. Interfere with your defense. Lie to everyone you know. Get everyone in the whole world to hate you. Take your kid, drug him, damage him, and then where do they end up? In the adult prisons. Complete basket cases. Movement disorders associated with atypical antipsychotic drugs. A lot of articles. Neuroleptic induced movement disorders or akathisia and violence. What psychiatrists do, they'll diagnose anybody. They don't care. They're desperate for patients, especially ones with good insurance. And they only make a living if they diagnose someone. And then they want to give them drugs because they're doctors, so they get paid more if they give drugs, and it kind of is good for their egos. And egos seem to be everything with those assholes. And they don't give a shit about scientific validity. They don't want to know about it. It offends them. Scientific journal articles, science, the fact that Lyme is a brain disease, offends the American Psychiatric Association. So that means they're crazy, because how can they be offended by a fact? Facts are gifts. They're meant to help you. They're tools. Neuroleptic-induced akathisia and violence. They give somebody a drug, makes them nuts, they commit a crime. Psychiatry says, see ya, I'm not there, and I'm not liable, even though they know they're liable, because it causes this agitation, violence. There's a couple of these, and they mention forensic concerns. Who's really liable here? Another one. From 1990, akathisia and violence. Akathisia and exacerbation of psychopathology, a preliminary report. The drugs make you nuts. They cause brain damage. You all spaz out. They don't care. Nobody ever gets cured by psychiatry. They don't care as long as they get paid. And they don't really know anything about the history of drugs because Big Pharma tells them what a drug is. This pesticide was a drug. This brain anesthetic, because it turned people into zombies, they said was a good thing. That's how stupid they are. Subjective emotional experience and cognitive impairment in drug-induced akathisia. Another one. It makes you demented. It makes you spazzed out emotionally, because the spazzed outness is caused by the brain injury. You're not spazzed out because you want to be. You can't help it. This is the same thing as people who have, like, addictions to street drugs. The drug causes a physiological disorder. Someone is an addict. Their behavior changes in response to the physiological addiction. I know people who are highly admirable, successful, smart people get Lyme, get hooked on the benzos for the pain meds, and then they start with the addiction's behavior. Counting pills and, trying to get drugs. People have told me, police have told me that they become injured on the job and they get some sort of a narcotic, and then they become hooked, and then they start doing these addictions behaviors, and they're cops. And they can't help it because they have this kind of brain damage from the drugs. So never start with psychotropics. Never start. The only condition where you would want to start is like in a hospital, you have surgery and they give you morphine. But don't ask for any more because it's just going to wreck you. And then response to traumatic stress by the stress experts. Bessel A. Vander Kolk, K-O-L-K. This is a top-notch trauma team. And they say that separation from parents in children ages 7 to 12 The highest correlation in the development of severe, complex post-traumatic stress disorder is separation from parents. DCF causes this. There's no way in hell there have been a 45% increase, 445% increase in the state of parents abusing their children. The national statistic is that only 11%, this is by Richard Wexler, only 11% of children taken away from their parents in this country really were abused or neglected. Roland's statistic was that there were 445% increase in children taken from their parents, and Roland claimed a 45% reduction in abuse. That means 10 times as many children were taken from their parents than need to be. It results in this. DCF drugs the kids because they're spazzed out, then they end up in the jails. The Roland Gate crimes were about a national string of prisons and juvenile detention centers. It involved DCF. Now, who would know better that the children that they capture and abuse are going to end up in the adult jails, such that this could be an enterprise. This could be a national thing. We can build these pediatric jails and prisons in every state. Lots of money. Bodies and money. This is Connecticut. This is what we do. And cytokines in the brain, implications for clinical chemistry. All these very valid, sophisticated articles about, really about care. What not to do. I give this to Neuroleptic, they bag me, throw me in jail, call me a terrorist. Second half of this notebook that I gave her was many of these articles out of the infectious disease reviews. This is the thing to get if you have Lyme and you want to know what all this bullshit is about. This is the publication. Sorry, I'm not able to focus on this. 1989. Upon the publication of this, September 1989, Reviews of Infectious Diseases, Supplement 6, all about Lyme disease and other spiral key diseases. Get this, because this was the status of the disease before the American Lyme Disease Foundation, which is a false nonprofit. It is a front for Kaiser and SmithKline, decided that spirochetes die after 30 days of antibiotics, and if you continue to say you have symptoms, you're nuts. We're not paying for it. So that was all bullshit. All that took place after this very significant findings given to Laura Lustig in the full text. DCF flipped out. Rather than help children who have Lyme, or help me and my kids who have Lyme, they bagged me, threw me in jail, called me a terrorist, said I was like Ted Kaczynski, and that I'm dangerously intelligent. Well, I guess that's the funniest thing anyone's ever been called. Anti-cardiolipin antibodies by Alan Steer, the lupus-like syndrome, as I talked about earlier. I'm going to stop this for the moment. Don't know if I'm coming back.